So, good afternoon. We have here Dr. Kojic. She's the chief of the Infectious Disease Division at Mount Sinai West. And she agreed to do this interview for the Women in Medicine newsletter. So I guess the first question I would like to ask you is, what advice would you give women just starting their career in medicine?
Advice, I mean, there is so many that I would like to convey. One, I think women are in a tough position because for whatever reasons, whatever fights we've done, we are still the ones that we want to have families, and how do you reconcile that with a busy training and a busy career? So my advice is to not overthink it. There's never a good time for women to have children. It's neither better when you start a new job nor when you're training. So make sure you encompass family planning into work life and not the other way around. I think that's that advice.
Okay, that's really good advice. So I guess you answered my second question. That was, how do you manage your life-work balance?
Yeah, and you know, we are not the only profession that this is a challenge for. I think in today's day and age, it's a difficult thing to do. But I think we as women, we should fight for making our workplace easier to encompass family. For example, you know, there are some ideas floating around there, but nobody really acts on it. Like, you could take one position and split it up between two women if they are at the stage in their lives of wanting to have children or wanting to start a family. I think we should work more on that to make the workplace, encompass family life and family planning.
Okay, thank you. So reflecting on your career, would you have done anything different?
That's always I mean, I can always think of something that I would have done differently, but this is almost impossible because everything that you do, it's like a domino effect. Every step that you take directs the next step, so to speak. So it's all connected somehow.
And
would I have done something differently? Probably, maybe put less emphasis on the career.
Okay.
I think everybody says that.
Yeah.
Everybody.
And what are some challenges you have faced as a female leader in medicine?
I think we're still at the stage, we still encounter, really difficulties, and we have to prove ourselves. We really have to work harder on proving ourselves than men, I think.
Yeah.
And for whatever reasons that is. But I've had several of these challenges where I've worked with, males or had male bosses that I would really have to, think thoroughly how to present things, because it's a harder sell if it comes from females sometimes, and I think we're still dealing with that. And I think your generation is gonna fix that.
Hopefully we will. We're trying. And I guess my last question is, how would you define success?
I would define success as having reached your goal. If you set up a goal and you know where you're heading, if you reach it, that's a success. Whatever that goal is. And it can be different for different people. For some people, being a chair of medicine is a goal, well then that's success. For other people, it's just, I want to have all of my patients really like working with me as a provider. If that's your goal, then that's your success. So that's how I define success.
Thank you for that. I think those are our questions. Thank you so much for your
You're
time for the
welcome.
Women in Medicine newsletter.
It's very important to do this.
So, and thank you again. I think female leaders like yourself help us, like our generation, to do a better job. So we really
Yes,
appreciate it.
absolutely. You are an amazing generation. You really are. This up and coming generation. It's really, wonderful to see how goal oriented people are. And look at yourself. You already made it by coming here to this residency. That's a huge achievement too.
Thank you. Thank you. I think that's it for today.